So let's start from the top. What are the most significant challenges facing Nigeria's healthcare system today? What would you say these are in your opinion?
Okay, thank you for having this. But first I'll complain. Why is healthcare always coming last? Okay, there's more. Okay, interesting. All right, I think one of the biggest problems we have in healthcare is accessibility. It's accessibility. You see, people believe that healthcare can be achieved, can be gotten outside the country. But most of what we have here, we've not even optimized it. And that's where technology comes in. It's beautiful what tech is doing in that space. I'll give you an example, right? We are UPTH Premium. We're actually the private arm of University of Port Harcourt Teaching Hospital. So I'm just going to give you the public and the private part of it. The UPTH is about 45 years, and on a weekly basis, they see about 8,000 patients. But guess what now? A good friend of mine, Dr. Chinedu, they stopped this app, it's called Our Doc. Within the first 2 weeks, they were able to register 20,000 patients.
Round of applause. Round of applause. You guys are hearing great numbers here.
Now, what I'm trying to say is, I'm trying to show us what tech can actually do to healthcare. Now, they set up this app, this system, and what it has done is that people know that they can get healthcare in Nigeria, but they do not know how to go about it. So you see, when it comes to tech, there's so much. When it comes to information dissemination, people look at tech in terms of just technology, the devices. It's much more than that. There's a lot that the healthcare depends when it comes to tech, AI, the blockchain, especially when it comes to validating the pharmaceutical value chain. There's a lot tech has to do with healthcare. So it's accessibility for me. People need to be able to access quality healthcare. The cost will come in later, but they should access that.
Okay, let me jump to you, Dr. Apah. With the state of infrastructure of health facilities around the country, what are the steps to be taken, both by the public and private institutions, to step up standards and efficiency?
Thank you very much. And I'll say thank you again to the organizers of this. But first, before I answer the health question, let me state this so that it will be on record. Yesterday in the EduTech sessions, we talked about how to bring equity as a conversation in it. I'll say this today, that until Nigeria stops using core members as teachers, we will not have it correct. And until we move core members into the agri space in its totality, we will not also get out of food insecurity. That must be the way we should go. Because when we discuss tech, education, if we don't get it correctly, we'll still produce doctors that are still not tech savvy, healthcare professionals that are still not tech savvy, and it brings us back to the problem that we're discussing today. Infrastructure gap. Because in my thinking again, the man in the village, in one rural community far-flung, deserves to get equal care as the man in the urban city. So we don't have the numbers, the Jackpot syndrome is there, so what do we need to do to equalize that? This is where technology steps in. And of course, you can see obvious infrastructure gap vis-a-vis manpower deficits, but you see the gap. How do we fix it? I'll give you the biopsy story in trying to see how we do it in the primary healthcare space. We do not have the numbers, but then the plan is, if there is a health facility, it should be easy for that health facility to reach out to a doctor away from that facility so we can leverage. If that facility is not having a doctor close by, we can have a higher cadre healthcare worker. Unfortunately, in the healthcare space, how we have trained healthcare workers, we trained it without some considerations. We lowered the cadre for training of healthcare workers. We have doctors, we lower down to JHUs. And we forgot that gonorrhea does not reduce in its intensity. It is gonorrhea in Abuja, Port Harcourt, and in the creeks in the Niger Delta. So we must need to strike that balance using technology, and that's why this conversation is as interesting today. For us in Bayelsa, we have created a data hub for data organization as a structure so that we can get numbers. If you don't know what the problem is, you can't solve it. And so we have that level of sensitivity to see how, when there's a gap somewhere, we can fix it. Now, with digitalization and the conversations thereof, we can better make these applications of healthcare work for the people there. What we do in Bayelsa, again, knowing infrastructure gap, we have collaborated with a tech company that provides us an electronic medical record system. That in itself, it's commonplace in a conversation, but that is when you are in an urban setting. In a rural setting, it's big deal, from data, how to get connectivity, and all of those. However, in piloting, we're having excellent conversations, how we can harness these potentials together and see how the underserved easily will get care from what we do. Maybe after now, probably mention what we have done in collaboration with Zipline to see how in Bayelsa, the farthest distances you can go to can be reached in an hour. Let me say this, with collaboration from government and Zipline, anywhere I go and mention this, if you have a snake bite anywhere in Bayelsa, you will die faster if you try to come to the capital city. But then through Zipline as a technology, you can reach them, and in less than an hour, very likely, you can get an anti-snake venom. And that is how we're bridging the gap around infrastructure and look at it carefully so that we can improve our health indicators. Thank you.
Thank you. Thank you very much. Okay, so let me get to you, Pharmacist Denyefa. In your opinion, how can data be leveraged to improve public health outcomes?
Thank you very much. If I can take you from what the last speaker said before I come to the question. When it comes to, I think our keynote address speaker talked about blue ocean strategy. In a market that is very competitive, we have a lot of innovations coming up. Just in the last 5 years, there's been a proliferation of startups across the country and even in Africa at large. But there's also something about providing access, right, at the point where it's needed. If we look at Zipline's innovation, which is what the last speaker just spoke about, it's providing access at the point of care when it's needed, wherever is needed. Take, for example, if we try to equate it on a road infrastructure level, we know that there's been a lot of projects ongoing to improve the road infrastructure in Nigeria, but it's still not at its optimum at this time. And the blue ocean strategy there is, how can we bring a complementary system to tackle the issue of poor road infrastructure, right? We have, I call them road networks in the sky, right? And that's what we are leveraging at this point to ensure that wherever is needed, we get those access. Now, when it comes to the issue of data, I think that's a very critical point in terms of improving public health outcomes. For example, not to mention particular states, but in certain states where we have epidemic outbreaks, I think we're all familiar with the Ebola outbreaks. We've had cholera outbreaks in certain parts of the nation. In terms of harvesting data or leveraging data to improve these outcomes, it's important that we now see where artificial intelligence comes in to provide predictive analytics. And to provide that predictive analytics, you need a sufficient database. What is currently happening in Bayelsa, for example, where there's a creation of a data hub to ensure that for every health outcome, we have a reference data, right? That is a good starting point. Not all states in Nigeria have that at the moment. But if I'm to say to improve our outcomes, right, in terms of public health, that would be the first step. We need to first tackle the problem of not just data integrity, but even putting together a system in place that in each of our states and even the country at large, we have a solid data network at the level of the ministries of health. Thank you.
Oh, thank you very much. Okay. Let me go to Philemon. A conversation was held earlier today, and of course, I couldn't tackle the speaker at the time or respond to the speaker. For a clear reason, she talked about data privacy, right? As a developer, what ethical considerations should be taken into account when developing within the medtech space, considering data privacy? If I'll put it in context, today when you go to the hospital, or every time you go to the hospital, if it's a different doctor, you probably have to start your medical history all over again. Yeah, we've had that experience a few times. I don't know if anybody else experiences that. So I'm asking, why isn't it easy for me to just step in, doctor clicks on something and can see my history? But there's feedback that there's data privacy laws. So how do you think development of technology around the medtech space should manage this issue?
Okay, so I'll start by saying that currently, what I'm working on is what I refer to as the digital infrastructure for diagnostics, more like diagnostics as a service. And one reason why we are building that is because when you're done with diagnostics at one particular hospital and you get treated, you do not have access to that data, right? And if anything comes up or you go to another area, you'll be requested to perform the test again. That is you spending double, right? Now, that brings into question the data privacy. In medtech, there's a lot of work to be done in that area because for this to work, for data sharing to work, there has to be a system to allow for a proper authorization for your data. So if, for example, you want your data to be shared between doctors or hospitals, you should play a role in authorizing that action. It shouldn't just happen that, oh, your data is found with another doctor automatically, right? You have to play a role in authorizing that action. So that is one consideration that we should pay attention to when building systems and infrastructures that empower sharing of data for continuous care. Because at the end of the day, all of this is geared towards ensuring that you have you have proper health care and also you have the best of care. Thank you.
Let me quickly add, maybe on a light note, when you say you must be in the conversation for your data to be used, that should be when you are not very sick. Because when you are sick, you need help. These conversations are out. But then we must get it clear in the principle of quality improvement in healthcare. Your health information is your right. Any hospital you go to, they attend to you. You just tell them you need it. The worst that can happen, you pay for photocopy. They photocopy for you and give you. You gave them the information, it's your right to have it. However, two doctors can discuss on the folder, on the case, without your consent. That is not data protection rights and all of those. It's also to help you and also improve systems. So in developing it and discussing rights, there should be data protection rights in digitalization and how this data is not found in public spaces for no reason and not among professionals that are into your own care and follow up as the case may be. You may not also be very correct to say you need to tell your history to a doctor every time. That is why there's documentation. So a doctor can just know this patient is a program patient, this patient is hypertensive, and ask maybe a further question to see why you came that day, or if it is for a routine follow-up. I put this context to the conversation. Thank you.
Awesome,
Yeah.
awesome, Chief. Dr. T,
I may add.
sorry.
Okay.
Time, please.
Time, okay.
Dr. T, let me get to you. I want to move us now to funding. I love what you've done with the UPTH premium. How should private players in your space drive funding for not just building bigger facilities, but funding for improving their hardware within those facilities?
Okay, thank you for that question. I know why you sent it to me directly. Before I start with that, I'll give a short story, right? You see, when you talk about funding, you have to look at the policy around the space. 10 years ago, we set up Nigeria's first online pharmacy. That was 10 years ago. It was in Body Thomas I set that up. Now, after I had set up that facility, we realized that there were no laws governing online pharmacies. So the only way you could distribute drugs, you had to have a brick and mortar pharmacy. So we now had to set up a pharmacy in Lagos, in Abuja, and in Port Harcourt just to be able to distribute. Now, we now got people ordering from all over the country, Gombe, Katsina, everywhere. So we tried to engage to say, okay, what do we do, right? Do we have to have a pharmacy in all these places? It's impossible. Now, of course, now we have software as medical device. We have other innovations. NAFDAC is doing a fantastic job. They've been able to create policies that support this. But where I'm coming from is that when you talk about financing first, there has to be a policy to support that. Now, when we did the UPTH premium, being a PPP project and a collaboration, it's like you're swimming in the blue ocean, like my elder brother said, right? There's no template. It's even difficult for you to even explain to the banks or to investors how you're going to go about it. So you see, for the ideal thing is that there is a value that should be created in healthcare. And so what happens is that when you have platforms like this that allows healthcare to be brought to the fore, and you have the media space where you have influencers talking about healthcare, people begin to appreciate what healthcare is all about, and you begin to have investors come into the healthcare space. But to be honest, it's not easy. But I believe there's a lot that needs to be done in healthcare. When it comes to innovation, when it comes to disruptions, it's much more than the devices. I keep saying it's much more than devices. We need to understand how our processes, automation, and the tech space come together to create the value for the patients.
Okay, with what you've just said, let me touch an area that, Philemon, I'm bringing this to you. Is there a world in which you envision that you can have hospital management systems in a blockchain that provides analytics for investment? So in simple terms, every patient who steps into the hospital could be tokenized and becomes an asset for predictive investment. Dr. T.
Yes, so that is possible, but the challenge that needs to be solved to enable that to happen is solving our poor data systems. So currently, there is no way to get national health data in one pool or one database that is accessible for that to happen. So until we fix our data systems, then we can start talking about how we can make analytics based off that information, based off that data.
Sorry, can I
Yes,
jump in there
yes.
quickly?
Go ahead, please.
Okay, you see, from an investor perspective, right? When you look at healthcare, when an investor looks at your business model, they do not see the people. They see in terms of numbers, revenue, projections, right? So there's a space for that, really. But you see, when it comes to healthcare data, you have to be very careful, right? HIPAA makes it difficult for you to really use someone's data in your predictive analysis as long as it's not clinical, right? So if I tell, for example, an investor, say, look, this is the amount of patients we have, and based on this, we have this revenue, right? It borders on being ethical, right? So it's a gray area which we have not fully exploited, but there's something to do with, there's something there. But when it comes to blockchain in healthcare, now this is for the entrepreneurs, the techpreneurs, right? There's so much space when it comes to blockchain in validating drugs, validating tests, ensuring that end-to-end value management in the healthcare space is managed. That is a space that nobody's playing in, and there's so much to be done there.
So with this, I will drop this on you, Denyefa, before we go to Doc for the last question. What do we do about commodity security, right? There's talk about a lot of fake drugs in the country. There's talk about drugs being sold in the open market. Is there a world in which we could deploy technology to track every medical commodity that is manufactured and distributed in Nigeria?
Yeah, so for this, there has to be a two-pronged approach to solving that issue. When it comes to open market distribution of drugs, it's actually, permit me to say, an epidemic in Nigeria, right? Because it's widespread. But looking at it from the perspective of regulation, there has to be two things that needs to be done. We have NHIA, right, which is the National Health Insurance Agency. There's a policy around insurance where every citizen, if I say by the show of hands, maybe by the show of hands, anyone here that is under an insurance scheme, a health insurance scheme, can we just identify either public insurance or private health insurance? Can we identify? So it's far between, like there are a lot of people that are still not under health insurance. By the National Act, it ought to be mandatory. But in terms of implementation, that is where the fault comes in. It is not being effectively implemented. That is the first step for us to get, at the subnational level, get our citizens under the health insurance scheme. What that does, it also provides a predictable cash flow in terms of managing a sustainable drug revolving fund. So if we take, for example, in 2005, Kano State is actually a model for most of the states in terms of running a sustainable and functional drug revolving fund. What if, for every state, they said after God is government, Abi, in terms of power, after God is government. So government has a huge role to play in this. Most states, about 20 states in Nigeria, have a drug revolving fund, some more functional than the others. But essentially, to provide commodity security and quality assurance of the medications that we get as citizens, there has to be that sustainable drug revolving fund. And to end on that note as well, I think it's also very important when we talk about commodity security, the citizens also have a role to play, right? If you go to a pharmacy, or if you go to let me say a kiosk, we have kiosks. We see some people that sell agbo, and then they'll tell you that this thing cures gonorrhea, it cures cancer, it cures this, it cures that. Trust me, you don't want to know the production process behind that. Even when we talk about it's coming down now, but there was a time where there was actually an increase in terms of skin conditions, vitiligo and the rest, even skin cancer, because of those substandard and adulterated products. So as a citizen, the onus now falls on us to even be very intentional about where we get this kind of commodities from.
Okay, last question before we go. It's coming to you, so you can
let me add this, and we need to be emphatic about it. The open market for drug system is a no, no, no. We have poor storage conditions with the open market. Before now, you go to Gutter Lane, my one. You go to Abba A line. You see the conditions of these drugs, and they come to our pharmacies. I mean, we will never get better. So technology needs to step in so that we can better place this. Let DMOs be created in states. Then we have technology to drive these commodities from the production, the pharmacies being produced, or how they are imported here, and how they reach. Now, where will technology come in? Proper barcode system, blockchain, everybody knows what is original, what is fake, what has been adulterated, and what has been denatured. So we must start the conversation to discourage the open market drug sales. That is critical to all of us getting well with the drugs when we procure them.
Awesome. Last question coming to you, so you can hold on to your microphone. Denyefa talked about the Drug Revolving Fund, DRF, and you also talked about the DMO, Drug Management Organizations at state level, right? And he touched on about 20 states having those laws supporting their drug revolving funds. Unfortunately, we know that performance is subpar. In your opinion, what should we do as a country, as a region, as a state? Is it more laws to support funding for public drug revolving funds, or is there a strategy around fundraising for public-private partnership to play in that space? Let's do it in 1 minute, please, sir.
All right, thank you. Let me quote my deputy governor, and he says, "Until the mouth gathers, it cannot whistle very well." Healthcare has everybody sitting in this room as a critical stakeholder. Nobody steps out in the conversation of healthcare. But quite often when the discussions come up, everybody is taken aback. Everybody say, no, it's for the doctors. We must come in this cooperation, in this partnership, to make sure health works. And the interesting part is, nobody knows when he or she will fall sick. So why not we prepare for that day and make sure the healthcare industry, the hospitality in healthcare works. Now, Dr. Teinye is big on the hospitality in the hospitals. But then we want everybody to be that interested in fixing that. That brings me to answering your question to say, for us to get a drug revolving fund to work, for us to get DMOs in states to work, everybody must be in the room and have this conversation sincerely. It's just corruption that has not made it work. And if this corruption borders directly on our lives, we need to sit up. This is where the techpreneurs come in. How do we get it correct? How do we collect the funds correctly so that the drug revolving fund can be sustained? That's the business. And so we must be intentional. Time is not on our side to say a few, but I told Philemon yesterday that we can build an app that can be a hospital online, that these conversations will hold. The future is here. Technology will take over. AI, they say, will take over. I said it is in the future. Until you need a surgery, you may not probably step into the hospital. So we must start having those sincere conversations if we must live longer. And thank you.
Thank you very much, gentlemen. Thank you to the audience for listening.